Dr. JP, I see you brought some new devices you have, and I see a battery. And I have to, before we start on this, I have to tell you a joke from Stephen Wright. And Stephen Wright said, a great comedian, he said, when he was younger, his flashlight didn't work. His mom said the batteries were in backwards, so he corrected it. Then his grandfather that he knew passed away, and as a younger kid, he went up to see him at the funeral, and he turned to his mom and said, maybe his batteries are in backwards. So there's a battery here, and I'd like to talk about this device you have and the whole topic of, you mentioned before in our pH video, we work on microcircuits, not large ones, microcircuits. pH is important, and this certain amount of electricity and polarity that's important in the body for everything to run at an optimal level. And tell us more about it, and tell us more about this device here.
Sure. Well, your body actually works very much like a battery. In fact, every cell is like a little tiny battery. The cell membrane is like a set of batteries. All of your muscles are actually batteries, and this is one of the reasons why exercise is good for you, because when you move your muscles, you're actually charging your batteries. And some people are so sick that their battery is really run down. And so in order to heal any kind of chronic illness, we have to do three things. We have to make new cells by having oxygen, the right nutrients, which are the building blocks, and the spark, which is the electricity. And that often means that we actually have to charge the battery, and we have ways to doing that. So if you have a rechargeable battery, it does depend on how you put it in the charger. If you put it in wrong, it doesn't charge properly. So we call that polarity. And polarity for a good functioning body has positive ions in the head and negative ions at the feet. So that's the first thing that we're going to do. So we use something called the Tennant biomodulator, which is actually a battery charger for humans. Mm-hmm. And this works off of something called frequency-specific microcurrent. And as you were saying, little teeny tiny currents often do much more for the body than big currents. So we're not really trying to zap anything. That's probably too much. We're just giving it enough of a spark to get those new cells forming. We actually use two parts, and we have different ways to connect this to the body. And so the first thing we do to set it up so that your polarity is correct is we use this device called a biotransducer for about 10 minutes, and that sets you up so that the polarity of the battery is in right. And then using different ways, we connect the biomodulator to your skin to actually charge the battery. That can take as little as 30 minutes if you're somebody who's like an athlete and you're just charging up after your exercise. Or if you're really depleted, you have a chronic disease like cancer or Parkinson's disease or chronic infections like Lyme disease or Epstein-Barr, you might need to wear it as much as all day long, 24/7. And so we actually have pads that we put on certain parts of the body to charge the body up doing that. And it's a very, very tiny, tiny current, so that you really should barely, if at all, feel it.
This is pretty radical stuff to someone who's never heard it before. I mean, can you talk a little bit about some of this origins? I know until I'd met you, I really hadn't heard of that. I mean, I understood the physics of the body, used biochemistry and everything else, a very complex system of using both chemicals and electricity to operate, but this is something I think that would be pretty new to people as a first experience to see it.
Well, that's a great question, because one of the things that many people are familiar with is a TENS unit, mm-hmm. which is often used for pain. But going back to our discussion of how microcurrents actually work better than larger, this is 1,000 times less than a TENS unit. And so it's really, really tiny amount. This is also an FDA-approved device to treat pain. Mm-hmm. And so we find that when we're using it for pain, There is good discussions about the Cleveland Clinic, Integrative Medicine Clinic is using this frequency-specific microcurrent. So we're learning how to use these tiny, tiny doses of electricity, because in the past, most of the problems came because they were using too high of a dose.
I see this a little like homeopathy versus Western, just the large jolt medication. The TENS is more of a large jolt, which doesn't mean it doesn't serve a purpose, but in understanding some of it, it almost seems like it just, the muscle just kind of collapses and surrenders, and there's some value in that. While this is more, seems more a homeopathy approach to address the system. Is that a close metaphor, at least, for it?
It's actually a pretty good metaphor, because homeopathy is probably working on the electrical system of the body as well. The less is more approach is often really important when we're talking about turning on the natural healing systems in the body, which is really our goal at our clinic. So we help people to access those innate systems that everyone is born with, that are there to help your body heal. And often the reason that people stay sick is that there's something that's simply keeping them from accessing that natural healing ability. And so we have to find that thing, remove it, and then help the body to turn itself on. And so that's what these kinds of devices are doing, is really, they're not like curing a specific diagnosis. They're just turning on the natural healing power of your body.
With the intention of the body taking over and doing this, but based on how severe the chronic illness is, if you were on your pathway to death from it, you might have to use it more. Is that correct?
That's true.
I see. Excellent. Now, you said this is FDA approved. Is this something anyone can purchase?
You can purchase it, however, it requires a prescription, because it is an FDA-approved device, and it does require training in learning how to use it. It's very simple. We actually usually train people in just one session, and we are offering a process at our clinic where you can actually come and try it. So we offer a package of 10 sessions for $25 a piece, so that it's very affordable for people to actually come and get the experience themselves.
Excellent. Well, how can they learn more from you about this and get more information with it?
If you go to our website, there is a tab for services. If you hover over that, down at the bottom it says Bioenergetic Therapies, and that will take you to more links and videos and things that discuss this type of healing.
Excellent. Thanks. If you enjoyed this, make sure to like it, and make sure you also have subscribed to the channel, and look forward to hearing from you. Thanks.